It's one thing to have data, it's one thing to have analytics, but we also need to have storytellers. We also need to engage our patients so that we can understand their journeys. And so when I think about the role that the American Diabetes Association plays, we always need to be at the cutting edge of innovation, but we need to be smart about how we do that.
I'm Asma Ali, U.S. Head of Established Products, and I'm here today with Chuck Henderson from the American Diabetes Association.
Thank you, Asma, for having me here today. I feel very privileged. Thank you so much.
Well, thank you for being here. So, Chuck, I'm going to ask you a couple of questions. What do you want people to know about your mission with the American Diabetes Association?
That's a great question. I get asked that all the time. And so the American Diabetes Association, we are here, our mission is to prevent, treat, and eventually find a cure for diabetes and also living with overweight. And so when we think about the United States specifically, there are 136 million Americans living with prediabetes and diabetes. And then another fact that I like people to say is that we launched Obesity Association. And so we know that 53% of the population has obesity. And so we feel like that because of our standards of care, we need to address that as well.
So what are you hearing from patients that really compels your work?
We have a great advocacy team at the American Diabetes Association. And so we advocate on behalf of people that can't advocate for themselves. And so that puts us squarely center in the patient and hearing what our patients are saying. And Asma, it's really about education. It's really about resources. It's really about tools. It's how do you get that information and meet people where they are, because as you well know, the primary care docs have 11 minutes. We also know it takes 4 to 6 months to see an endocrinologist, right? And so we've got to get that information in their hands. We have to meet them where they are, and it's all about access for all.
You've highlighted some really important points. What's one urgent thing that needs to be done now to help patients?
I would say we all need to come together. The American Diabetes, other partners, we need to come together. It needs to take public-private partnerships that want to make sure that we put patients at the center of everything we do. And we have to lead with that. What do our patients want? What do our patients need? It's going to take multiple entities. It can't take just the ADA, a not-profit. It needs, other partners to really say, okay, we're going to address this need and we're going to address people and meet people where they really are.
I love that. So what gives you hope about the future of scientific innovation?
Well, look, the United States has always been the leading in terms of innovation, right? We are the innovation hub of the world, and we need to stay true to our principles, right? It needs to be fact-based, it needs to be science-based, and we need to stick to that. And I also think another add to that is that we need to be storytellers, right? It's one thing to have data, it's one thing to have analytics, but we also need to have storytellers. We also need to engage our patients so that we can understand their journeys. And so when I think about the role that the American Diabetes Association plays, we always need to be at the cutting edge of innovation, but we need to be smart about how we do that.
Amazing. Thank you so much for being with me here today.
Thank you. And I really
Appreciate it.
enjoyed your time. Thank you.
Me too.